Hello students, I am Dr. Gayathri, Assistant Professor at Smriti College of Pharmaceutical Education, Indore from the Department of Pharmacology. In our today's class, we will look at the treatment aspects of angina pectoris. So the drugs used in treating angina pectoris are called anti-anginal drugs. So coming to the treatment part, why are we treating this disease? What is the end result that we want to achieve while treating this disease? So these are to return patients to their usual activities with minimal angina, chest pain or discomfort, and to reduce the risk of sudden death, to prevent progression of the disease into myocardial infarction, to lessen the symptoms severity and frequency. So these are the treatment goals of angina. So coming to the classification, in our previous class we have seen the pharmacological classification of these drugs. So there is another method of classification, that is clinical classification. So in this, the first class is drugs used to abort or terminate an attack. This is for an immediate action. These include GTN, isosorbide dinitrate, and in sublingual form. Coming to the drugs used for chronic prophylaxis, they are all the other drugs except these two drugs. Anti-anginal drugs, in our previous class we have seen that there are 5 classes of drugs. They are nitrates, beta blockers, calcium channel blockers, potassium channel openers and other drugs. So what is the main strategy by which these drugs work? So we have seen in the definition itself that in angina the oxygen demand and supply, there is an imbalance between these two. So the drugs acting in angina, the main strategies by which they act is they either reduce oxygen demand or they increase the oxygen supply. So the two main strategies are reduction in oxygen demand or increase of oxygen supply to myocardium. And coming to the first class of drugs that are used in treatment of angina are nitrates. So today we will look at nitrates, the pharmacology of nitrates, by taking glyceryl trinitrate as a prototype. So the mechanism of action of these drugs is organic nitrates, they get converted into nitric oxide, and these nitric oxides stimulates systolic, cytosolic guanyl cyclase. So when this happens, it increases the intracellular cyclic GMP levels. Because of this action, two things happen. One is dephosphorylation of myosin light chain kinase and reduction of cytosolic calcium. So this dephosphorylation results in inhibition of contractions, and the other effect is relaxation of smooth muscle. So contraction is inhibited and relaxation of smooth muscle is happening. So this is the mechanism of action of nitrates. Coming to its pharmacokinetics, they are lipid soluble drugs, and all the drugs are well absorbed from buccal mucosa, intestines and skin. So when ingested orally, all these drugs except isosorbide mononitrate, all of them undergo extensive and variable first pass metabolism in liver. Coming to the adverse effects, the first adverse effect, the most common adverse effect seen in these drugs is headache. And when these drugs are given at higher doses, postural hypotension, facial flushing and tachycardia can also be seen. So one major interaction of these drugs is with phosphodiesterase 5 inhibitors. So phosphodiesterase 5 inhibitors such as sildenafil, when they are used, their action will be potentiated, and this can result in dangerous hypotension. So these drugs are contraindicated. So if a patient is on phosphodiesterase 5 inhibitors, either of these drugs should not be given. So coming to the other effects of nitrates, we can see tolerance and dependence in patients who are taking these drugs. So coming to tolerance, when patients are taking this nitrates for considerable amount of time, the blood vessels get desensitized to their vasodilation action. So to avoid this, what should be done? The patient should be provided with a daily nitrate free interval. And coming to dependence, if a patient has been taking nitrate for quite some time or a long period of time, and if the patient suddenly withdraws, the patient starts experiencing spasm of coronary and peripheral blood vessels. So this effect can be avoided by discontinuing the drug gradually instead of suddenly stopping it. So gradual withdrawal is a solution for avoiding this effect. So this is about the pharmacology of nitrates. In our next class, we will look at the next class of anti-anginal drugs, that are beta blockers. Hope you all understood. Thank you.